Surprising statistics about colorectal cancer. The American Cancer Society says this disease is more likely to strike certain minority populations and that different regions of the country have higher colorectal cancer rates than others. And new cases continue to rise for people under the age of 50. Here this morning, Dr. Robert Gelfand of Weill Cornell College of Medicine and Betty Wu, a patient with stage 4 colorectal cancer. Thank you both for joining us.
Thank you.
Thank you.
Doctor, I'd like to start with you here. Specifically, which groups are more likely to develop colorectal cancer, and what parts of the country do you see have the higher rates?
Well, Hispanics and African Americans are more likely to develop colorectal cancer. Though in 2012, the estimates are that there'll be about 10,400 new cases of colorectal cancer in Hispanics and almost 17,000 in African Americans. With regard to which part of the country, the South seems to be hit a little harder than the rest of the country.
What do you think the reason is for the disparity, whether it's race or geographic location?
I think the same answer for both is access to care. Fewer people going for appropriate screening colonoscopy, fewer patients going to their doctors with signs and symptoms that may be related to colorectal cancer, which is why we've teamed up with Genentech to try and raise the level of awareness that's needed.
Betty, you're 31, as am I, so I'm interested in hearing about your story. Could you share with us when you were diagnosed and what you were experiencing prior to that?
Yeah, sure. I started to have abdominal pain when I was 27 years old. It was ongoing, well, it was pain for a couple of months from time to time, like, for example, after I drink soda. That's why I didn't take it seriously until one day the pain got really bad and I went to the hospital for a checkup. And from then I was diagnosed with stage 4 colon cancer. I did a colon resection surgery followed by 6 months of chemotherapy and Avastin, and I was in remission after that.
Wow.
Today I'm doing very well. I'm still doing the similar treatment and I'm in complete remission.
What would you recommend to others who might be in your situation?
I would encourage the people who are fighting with colon cancer to be brave, strong, and be positive all the time. Thinking about the good side of your life, to me, I'm still working part-time, so you can always find something fun in your life, and it's not the end of the world.
Doctor, she mentioned Avastin. I think that's probably part of the hope for our viewers who might be watching now as well. Is there a place online where they could learn more about it or about colorectal cancer in general?
I think an excellent website is ccalliance.org, coloncanceralliance.org.
Thank you very much for your time. And Betty, an inspirational story. It's good to see you. Thank you.
Thank you.
All right, Mike, over to you.